Good day everyone, this is Karing Meiji Tambaling of BSN2C, and today I will be performing the blood glucose testing for my return demonstration. The main purpose of this is to determine if the sugar level of the client is in good range. And of course, this procedure is oftenly used to determine or to diagnose if the client is diabetic, and also this is used to monitor the sugar level of the diabetic client. In performing our procedure, we are going to get two important things, which includes the gloves, which is used for us to protect ourselves and to protect the people around us and to avoid also the cross-contamination. And we have in here, most importantly, the blood glucose test kit. And inside it, there are contents, and I'm going to open it and show it to you. There are four major contents of the blood glucose test kit, which includes this one. This is the reagent strips, which is used to determine the glucose concentration. And we have in here the antiseptic swab, which is used to clean the puncture area. And of course, we have in here the lancet. This is used for us to take some blood sample from the client's finger. And we have also in here, most importantly, the glucometer, which we are going to use to see the glucose level of the client. This kit is very important to accomplish our procedure, and we have to keep our things, or we have to prepare our things beside us for a fast and comfortable procedure. As a general rule, we are going to perform hand washing. This is to prevent the spread of infections, and also this is a way for us to protect ourselves and the people around us. After performing hand hygiene, now we are going to enter the client's room. Now we are inside the client's room, and the next thing that we are going to do is to provide a privacy. But before that, we are going to ask our patient if she wants us to close the door and the curtains. Ma'am, would it be alright if I close the door so no one from outside will be able to disturb us as we go on to the procedure? Okay. Okay. Good day, ma'am. I am Karing Meiji Tambaling, and today I will be your student nurse. Ma'am, may I know your name and your birthday, please?
Lina Bangilan, and born May 15, 1956.
Okay, that's great. Okay, so for today, I am going to perform the blood glucose testing, which means I am going to take some blood from your finger so I could check if your blood glucose or your glucose level is in good condition. Would that be alright, ma'am?
It's okay, ma'am.
Okay, well, don't worry, ma'am, because the test will be much easier and it will be fast and it will not be that painful. So are you ready, ma'am?
Yes, ma'am.
Okay. Okay, the first thing that we are going to do is to assess the fingers or the hands of our patient, and we're going to check for the possible puncture area. Okay, I'm going to check for any lesions, cuts, or any bruises in here. Is it painful, sir?
No.
Okay. May I have your other finger, sir? Okay. Check for edema, inflammation, lesions, cuts, and any rashes. And we're going to see for the possible puncture area. Okay, we have to avoid any lesions of our patient so it will not be painful for the client. Okay. Okay. The next thing that we are going to do is to put the patient in a good position where if he or she is lying down, we have to put some pillow over his head or over his back so it will be more comfortable for him. And then if he must not be standing position, so the most ideal position is the sitting position like this so we can get it more comfortably. To ensure the sanitation, we have to ask our client to wash his hands first. Sir, would it be alright if you go to the bathroom and wash your hands first before we go into this procedure?
Yes.
Okay, thank you, sir. Okay, now we are ready to open our blood glucose kit, and the first thing that we have to do is, of course, to open it. And then we are going to put out the contents of the glucose test kit. And we have in here, I have explained it a while back. There are 4 important things inside it. Okay. And then the first thing that we have to do is to take out some reagent strip over this vial. And we have to do it properly and reseal it back again to keep the quality of the reagent strip. Okay, we're going to take some. And then we are going to get our glucometer. And then we're going to insert it inside. Remember that we have to keep it straight and not to bend it. We have to do it very gently. Okay. Note that as we insert the strip, it automatically opens, so there's no need to open them. And additional information in using this one or the reagent strips, we have to remember that there are different available reagent strips and blood glucose test kit, and we have to follow the manufacturer's instruction. There are different, but we have to follow what is inside or what is given or instructed by the manufacturer. Next thing to do is to prepare our lancet. We have to remove the cap from it, and then we are going to replace something inside. And we're going to replace something new inside, and then we're going to cap it again. And then we have to adjust the part of here. And then we're going to adjust the puncture depth, and then we're going to turn it on. And the next thing that we are going to do is to take the finger of our client, and then we're going to place it in there. But before that, we are going to put the gloves over our hands. After putting on our gloves, we are now ready to take the hands of our client and locate for the puncture site. And then we're going to apply some pressure over it, but not squeeze or massage it. We have to apply some pressure over it only. And then the next thing that we have to get is our aseptic gloves, and we're going to apply and clean it over in here to, of course, provide or to make sure that it's clean. And then the next thing that we are going to get is our lancet, and we're going to turn it on or press it over in here, and then we're going to tap it on the puncture area. Remember that we have to put it on the lateral area, not on the tip of the finger, because it will be very painful for the client, and we don't want that. So we have to put it gently, and then just tap it in here, and then release the button. Okay, and then put it in the side. And then the next thing that we are going to get is our glucometer. We have to remember to keep it turned on. And then on the tip of this reagent strip, we are going to get some sample blood. And then we have to note that inside, we're just going to see and wait for a while. And then again, we have to clean the client's finger and apply some pressure. Okay, with that, after taking blood from the client, we have to remember to watch our glucometer. And remember that the normal range is about 70 to 99. So above that would mean that our client is on a diabetic or pre-diabetic. Okay, before going out, we have to remember to keep our materials inside our glucose test kit, and we have to remember to thank our client for his cooperation. Sir, thank you so much for your cooperation, and I will be back to tell you the result of your blood glucose test. Would that be okay?
Yes.
Okay, thank you. Okay. After performing our procedure, now we are ready to remove our gloves and to wash our hands. This is to protect ourselves and of course to avoid the cross-contamination and to avoid the spread of infections. And now we are back to tell the client the result of the blood glucose test, and we are going to tell him what are the things that he has to do with the result of his blood test. Sir, now that I'm back, I have here the result of your blood glucose test, which we have done on the previous procedure. And I have found out that your glucose level is quite high. It's about on 100. That means that we have to put your diet in a good condition and we have to do more exercises. So we can put it on a normal range, which will help you to function well. So would that be okay, sir?
Yes.
Do you have any questions, sirs?
No.
Okay, that's great.